tonight.
Now is the single best time and best opportunity to defeat Obamacare.
We are done.
Repealing the Affordable Care Act is wrong. It was wrong the first time. It is wrong the 31st time.
If the president's not going to implement the law, we're not going to fund it.
Welcome to Groundhog Day in the House of Representatives.
This law is not working. You don't have to take Republicans' word for it. You can take Democrats' word for it.
The House this week is going to vote for the 40th time to repeal the act. You aware of that?
Wasting the country's time by taking something like 40 meaningless votes to repeal Obamacare is not a jobs plan. That's not a jobs plan.
President Obama will scream and yell that the mean, nasty Republicans are threatening to shut down the government. And at that point, we have to stand up and win the fight.
We're sitting here wasting time and taxpayer dollars trying to find any possible reading of the law, a technicality, to take away health care from the people who need it most.
I don't think you can say you're against Obamacare if you vote for a budget that funds it. And I think it's outrageous that the president and his allies are threatening to shut down the American government if it doesn't fund Obamacare. Obamacare is not more important than the United States.
Senators Coburn and McCain now categorize the House's efforts to defund ACA as dishonest and hype.
For us to force this on the American people when they're having a hard time finding work is the wrong approach, absolutely the wrong approach.
Now is the time, now when it really matters. This is the time to stop Obamacare from hurting more Americans across the country.
And welcome to Hannity. It is considered the cornerstone of the president's domestic policy agenda, and now the debate over Obamacare has returned to the forefront of American politics. Now, efforts to defund the controversial law are now raging on Capitol Hill. Doctors are threatening to close down their practices. Many business owners, they're facing an uncertain time and future thanks to the mountains of new and very costly regulations. And with all that in mind, tonight, for the hour, we have assembled a studio audience of doctors, healthcare executives, political commentators, business owners, and much more.
Personal responsibility would be really important here, and extending entitlements, very comprehensive insurance. And, I don't actually agree that Americans are confused. I think after 2 years of this debate, or 3 years now, in doctors' offices all across the country, physicians are overwhelmed. They're almost to a doctor not happy with this law, and patients are aware of it. Well, we're the engines driving this. And if you can't get in to see us, or we're ordering very expensive tests that are variable prices, there's no way that we can afford it. There's no way we can keep practicing medicine the way we want to.
The American College of Physicians, the American
Ryan, go ahead.
Ryan, I'm a business owner. I've got 120 employees. I pay for 100% of my employees and their families' insurance premiums.
What kind of business?
Book publisher. I got an author here. Stan's one of my authors.
Is that right?
You brought your book, right? All right. I've got 120 employees, about 300 on the total plan. I'm a mid-year renewal. It comes up in September. Blue Cross Blue Shield has increased our premiums 31.7%, Sean.
What are you going to do?
I'm looking for options. We're looking in Oklahoma.
Well, they'll have a more inferior plan, right? You won't be able to offer as many benefits.
Out of pocket. We'll have to increase deductibles. At the end of the day, they're going to be in worse shape. And I don't like that.
Sean, there'll be competition that comes in. That's not because of Obamacare. That's the beauty.
Right here.
All you have to look at is the White House is in panic mode right now. I mean, they know that public opinion on this is shattered. Even in the president's own home state, in Illinois, in Democrat congressional districts there, this thing is unpopular. People want it repealed. And just the other day, just this week, Barack Obama went down to Capitol Hill for a birthday party with Nancy Pelosi. They had cake together. And you know what he said there?
It's good for your heart, good for your health.
He said his biggest goal is to get Nancy Pelosi as Speaker of the House again to protect Obamacare. He knows this thing is crumbling, and that's why this next election is critical, because if she's back there,
I actually want to see the Republicans fight, and I think strategic. I want to see them defund it. I want them to engage the American people, fight back against the propaganda.
What is the solution? What is the ultimate solution for the problem of so many Americans not having health insurance?
I think the answer is we stop this because it won't work. I prefer medical savings accounts with catastrophic care, and you build the money up over a lifetime.
Well, someone needs to educate the public on that.
The problem with that is if people don't have preventative care, that is going to increase the chance they're going to have chronic illnesses.
Patient accounts incentivize preventative care.
I don't want the government telling me how to.
Oh, I'm sorry. Go ahead. Yeah.
Government deciding what kind of health care I have. I want options.
Yes,
I want options. And Sally
Sean, if
take up Sally's challenge of
yes.
the alternative, what we really haven't had for decades, and that is real free markets in healthcare, like we have in food, turning scarcity into abundance, and that means to have real free markets and real safety nets like we have with food.
Crossing state lines.
And Sean, if we had good health care, we wouldn't have to force people to buy it. You wouldn't need a mandate if it's worthwhile for people.
Yeah. All right, I'll tell you what, we'll take a break. We'll come back, our final segment as we continue on this special edition of Hannity. We're glad you're with us.